Welcome to another Friday in where are we at now? May, and a discussion on the COVID-19 crisis. So, once again, I'm Dr. Shelley Glover. I am a board certified obstetrician gynecologist, and I specialize in anti aging, hormone imbalance, and wellness. And this is a follow up on what's going on with the COVID crisis currently, and especially here in Central Florida, which is where I'm located. This week I'm not going to have a guest speaker. Next week I've got a couple people lined up, some more survivors that we can talk to and get more of a community perspective on that. But for this week I thought I would just kind of go over kind of what's been going on in the state of Florida since we reopened last week, and also hold on one second, guys. Just make sure I've got the comment section open. Yeah. So, and then also to answer any questions that you guys have. So, first of all, Florida was in quarantine from March 27th. We were let out of quarantine into phase one last, I guess this Monday that just started. And so far, so good for us. Florida's different than a lot of other places. We discussed this last week in the fact that we are a commuter town, and for the most part, and we don't have the public transportation that, like, say, New York or someplace like that, one of the big cities does. So a lot of our people drive by themselves when they're going places, or very minimal people in the car, and then our houses are more spaced out as well. We don't have as many people living in high rises and close quarters. And I think that has really helped us a lot. Also, even though we may have been a little bit later than many of us wanted to be in going into quarantine, when we did go into quarantine, people did do what they were supposed to do, and we were able to flatten the curve. So the great thing is that our numbers are actually very stable right now. If anything, they're going down as far as the percentage of people that are testing positive with the testing. So that's really, really good. As far as our numbers of deaths and hospitalizations, that's also doing very, very well, at least here in Central Florida. Now, South Florida is still a different kit and caboodle. They were the hardest hit. They still continue to be the hardest hit. Almost 50% of the cases are still down there. So when I'm talking primarily about how well Florida is doing, I'm really talking about the rest of the state outside of the Broward, Miami-Dade area. Right now, just to update our numbers, with worldwide, we have 3.9 million cases of COVID, 274,000 deaths worldwide. The United States has gone up to 1.3 million cases of COVID-19 being diagnosed. It was, just for you to know, it was 1 million last week. So that's another 300,000 people diagnosed. Within the state of Florida, we're at 39,000 diagnosed, up from 34,000. Deaths, 274,000 in worldwide, 77.9 in the United States. That's up from 64,000 last week, and 26% of those are in New York. And then if you add New Jersey to New York, we're looking at about another 9,000. So over almost a third of the cases of deaths are actually in the New York, New Jersey area. Florida's done fairly well. We're at our total rate is up to 1667. That's up from 1314. That's about 300 more deaths this week, and we had about 300 more deaths the week before. But remember, that's statewide, and those are people that primarily were already ill. So what we're seeing, like I told you, is that the more we're testing, actually the the percentage is actually down. So we are doing more testing. So our numbers are going to go up as far as our total numbers of people that are positive, because we're testing more people. But as far as our people that are ill, we're not seeing that. Now, we'll talk about testing a little bit more. We'll talk about testing a little bit more in a minute. Within Lake County, we have 237 cases, 59 hospitalized, and 14 deaths. That's only one more death from last week. Not to say that that's not a lot. We don't want to lose any of our people, but it's not like the numbers that, like you're seeing in other places. Orange County has 1478 cases, 300 hospitalized. Now, about 40 of those patients that are in the hospital are not Orange County residents. And deaths went up only by one, from 34 to 35 in the last week in Orange County. Seminole, 410 cases with 95 hospitalized and 10 deaths, which is 2 more than they had before. And Sumter, which, like we've talked about before, is an older population. Their numbers went from 217 to 239. Hospitalizations, though, were only 41, and deaths maintained at 14. So that's excellent because, once again, that's an older population. So we're happy about that. We did open up, like I said, at 25%. Now, I can tell you, obviously, on Cinco de Mayo, the restaurants were not at 25%, especially the Mexican restaurants. There was a significant amount of people in the restaurants. I don't believe that was actually being enforced. But so far, we seem to be okay. We'll see as we go into the next week or two how that goes. The beaches are open. The parks are open. And they are encouraging social distancing. How much of that is occurring? It seems like the beaches are pretty good, and the parks, I haven't seen any pictures on that one, but I would assume that that shouldn't be that difficult to do as well. In my office, just so you know, we are we've been seeing patients. I think you guys know we've been open on Tuesdays and Wednesdays. Starting next week, we're going to expand to 3 days a week. We'll be open Tuesday, Wednesday, and Thursday. We still do not want you guys just to walk in. We are doing everything by appointment, whether that's picking up supplements, whether that's getting injections, or whether it's actually being seen. But you can be seen, and then we're doing telehealth. We will be doing telehealth on Mondays and Fridays because that's become extremely popular, and a lot of our clients like being seen from the privacy of their own home. So that will continue, and we will see what happens. Stay tuned next week as far as whether we open up further than the 3 days, because we will be slowly expanding back to the 5 days, God willing, by June is the goal. And we also will be we can resume elective cases as of this past Monday, and we are doing those, and we will be resuming our aesthetics starting next week. What else do we have? We have, we talked last week a little bit about the hospitals. They are doing elective procedures. So please, if you've been delaying any procedures, ultrasounds, etc., then go ahead and get them done. I'm still talking to clients and still getting a lot of reluctance about going to the hospital. And I get it. I really do get it. And I mean, it's your decision, and you have to decide whether you want to go to the hospital or not. There are freestanding facilities as well where you can get ultrasounds and CT scans and MRIs. So if it's a radiology test, then you can certainly go and still get your test done even if you don't go to the hospital. But do know, like say, for example, at South Lake Hospital, as we talked about before, the radiology suite is actually in a completely different building than the main hospital, on its own floor. So for the Women's Center, and then the other portions of the radiology departments are actually, even within the main hospital, kind of off in their own separate section. So it's not like you're walking through the emergency room to get your blood work done or something like that. So I really do encourage that you don't put things off that need to be taken care of, especially if you've been putting them off for a minute already. And I am starting to see more of that, where people are coming in and they haven't gotten their test done, or they haven't gotten their blood work, or they haven't stayed on their medications because of what's been going on. So get it, understand it, but now is the time to kind of just start. You can't go backwards, can't change anything, and God willing, there's been no negative things that have occurred from that, if we're lucky. But at the same time, let's go ahead and start getting back into making sure that our health is good. Once again, if you if you have an illness, especially high blood pressure, or diabetes, or anything that is weakening your body, that makes you actually more susceptible to getting a bad outcome if you got the COVID-19. So taking care of your health is really, really important. Don't go the other way and think that hiding in place and not getting out and getting the care that you need is the right answer, because that's actually the wrong answer. As far as testing, we've got a lot of questions about the testing. So the testing is it's confusing. So there's 2 tests, and then within the test there's different tests. So there is the main test is the antigen testing. It is looking at whether or not you actively have the disease now. Okay, so that's either a nasal swab way up the nostril, or they can do it in the back of the throat. And now they also are having another one where it can be done by saliva. And that's being done through Quest Laboratories and can be done in the privacy of your own home and sent back. The reason why you do that test is because you think you might have COVID-19 right now. So I've got symptoms, I've got the fever, I've got just feel really, really sick or really, really fatigued, or the cold flu symptoms, but I don't have the cold or the flu. Or I think I've been exposed to somebody that actually has been now diagnosed with COVID-19. All of those are reasons to go and get the test done. And there's plenty of places, which is great. So I would say, there's a lot of controversy about how Florida has been handling things. I think there's controversy everywhere in every state, I'm sure. And I am not here to get into politics. But I would say that at least now, Florida is sitting pretty as far as we've got the test now. We've got we've got antibody testing, which I'm about to talk to you about, and we have the regular test, we've got the antibody test, and we have the personal protective gear. So we're ready. We are prepared, and we didn't get the onslaught that we thought we were going to get when we were anticipating it. So we are set for the next several months, unless something goes grossly wrong and our numbers explode much higher than we're anticipating. So we're really excited that we are in the place where we are right now. So we talked about the screening test a little bit. The other test is the antibody test. That's a blood test, and that test is checking to see, have I had COVID-19? So did I have the disease and didn't even know it, or I was sick but I wasn't that sick and I didn't know how to get tested, or I didn't want to go out, so now I'm over my illness, but I want to go ahead and see whether or not I've had the disease or not. So that's the antibody testing, and that's really, well, ideally we're gonna get I think that's the best, is what I'm trying to say. I can't get the words out. So anyway, so currently the tests are just rolling into Florida. We're just getting them. The hospitals have them. They and somehow the trickle down is starting in Jacksonville and then coming down towards Orlando. So we will have access to testing. I've seen conflicting information right now regarding whether the mobile sites have it. So it's one thing says it does, and then I've heard they don't. So if it's not, I think within the next week we will be testing for antibodies. The benefit, why, and I see Dr. Senior's on the phone, so if Senior's on the phone, so if you know the answer to that, pipe in. The benefit of knowing you already had the antibodies is that you are basically, from what we hope and what we see, it appears that you have some degree of immunity. Whether you're 100% bulletproof, we don't know yet, but it's definitely way better than not having the antibodies. And so, especially say for healthcare workers, it'll be very reassuring, because not only for you, the patient, if you go and see someone and they've already have the antibodies, then you can feel safe that the person taking care of you is not communicating the disease to you, and also also it helps the healthcare worker because they're not constantly in fear that they're going to contract the disease. And so we will have doctors and nurses and first responders who are, some of their fear and their anxiety will also be relieved, and they will feel comfortable being able to take care of the COVID patients and not feel as at risk. Now, does that mean you test positive so you don't do any of the precautions that we're recommending? No, we're not saying that. I mean, you still want to be careful. Also, there's some controversy about whether or not we do have the full immunity. When you look overseas, there have been some cases where people have supposedly tested positive for having the antibodies for the COVID, and then they've gone back and found that they actually have gotten, quote unquote, the disease again. Now, we're not sure. We think that that's just not been the best as far as testing and recording those records. So we're hoping that there is good immunity that's there. It appears overall that is going to be the case. How long the immunity is going to last for, we don't know. And also remember that within viruses, they always are usually constantly mutating. So just like you notice that there can be different strains of the flu, we're anticipating there are going to be different strains of the coronavirus as well. There's already thought that the coronavirus that is out there, that some of the coronavirus that's, say, here in the United States is different than what was actually in Wuhan. So viruses can morph, they can mutate, and so just because you're immune to coronavirus now doesn't mean that, say, in the fall or in the winter, if there's a new strain, that you can't get that. But we're still going to be really excited if we can get people who have the antibodies. And the other thing that's going to be really helpful, as we talked about last week, is that they are using the plasma from the blood of people who have the positive antibodies who have had the disease, and using that to treat the patients in the hospitals who are ill, severely ill with the coronavirus. So that's another really, really big thing and important. So if you do the antibody testing and you are positive, we would really like you to donate your blood so that your plasma can be used to help save someone who needs it. So that's another really, really big and exciting thing that's occurring with the antibody testing. So I hope that helps, because it seems like there's a lot of confusion as to which one you can do. As far as can you get tested at all, because that's been a big question as well. At first, you had to meet really, really strict criteria. Now, depending on where you are, at least in Central Florida, there are places where it does not matter. You can get tested if you want to get tested. It doesn't matter who you've been exposed to or whether you're ill or not. But definitely, like I told you before, if you are showing any symptoms or you're a healthcare worker, you can definitely get tested. As far as the antibody testing, because those are going to be in less supply, at this point, I believe it's basically people who can give history that they have been ill with at least flu-like symptoms, etc., in the last since probably about January or after, and that those are the people that are going to be tested, or people that are known to have been positive for COVID-19. Then those people are obviously automatically eligible to be tested for the antibody if it's been at least 2 weeks. You don't want to test too soon because you want to give the body a chance. The whole point of antibodies is that your body has built up a resistance to the disease. So you have to give your body a chance to convert over and say that it's cured from the disease. It's not for the active disease.